This program has been made possible in part by the following sponsors. The Trial Lawyers Association of BC. The Vancouver Courier newspaper. My new book about addictions, All the Way Home, Building Recovery That Works. Perhaps we might persuade someone in authority in the provincial government to do an audit of the health authorities because they've been behaving very strangely for some time now, making peculiar decisions. But I think I figured it out. I think they subscribe to the chessboard school of management. It works like this. You move pawns around, you move characters around on the chessboard. All looks very good on paper. The only problem is it plays utter havoc with human beings and with processes that have been in place and that are honored by people in local communities. Well, more about that as we go along. Lately, we've seen pieces in the press back and forth about the shutting down of 5 local health centers, one of which is the Mid-Main Center, and moving most of everybody towards one place at 8th and Ontario. Oddly enough, that place where seniors and others are expected to go to now is a place that specializes in mental problems and addictions. That'll be a nice mix. 2 of the ladies who've been very involved with Mid-Main Community Health Center are here with us today. Joann, well, I don't know why I want to call you Avery, but we'll call you by your real name, Joann Perry,
yes.
And Marcy Cohen. Thank you so much, both of you, for joining us. Tell us about your involvement first, and then tell us about the center.
Okay, so I am a patient in Mid-Main for 20 years.
Wow.
And, yeah, and I came there very dissatisfied with my previous care and really glad with the kind of care I got consistently. And, and everything I say, I find when I've talked to other patients, I'm working with other patients, they're all saying the same.
What was the big leap, Marcy? What was the big difference that you felt right away?
There was a lot more responsiveness and listening to what I had to say. I really could tell that the doctors knew what they had done, a lot of research, had done a lot of background, were really careful, explained things to me, helped me make decisions with them.
Great.
Never had to wait a very long time. If there was something urgent, they were there for me. If they were concerned and didn't know something, they found a way of solving it. It was just a really, really, really responsive type of care. And we've had some meetings with patient groups, and everyone is saying exactly the same thing.
And this has been your experience as well, John.
It's mine is. I personally found it dramatic in the sense that I had been away for a bit. I needed a new doctor. I found a doctor. I saw that doctor who thought that because I had a lot of pain in my hands, I was diagnosed with rheumatoid arthritis, and it was a fair assumption. It could have been
12 other things.
Right, and my sister had rheumatoid arthritis, so that sent things over. And the doctor wanted me to go on steroids and an ever-increasing.
Ouch.
Well, I pretty much said what you just said, David.
Good for you.
I said, ouch, I don't really want to do that.
Yep.
And the doctor said to me, if I tell you to take steroids, you're going to take steroids.
Oh, no, that's the wrong doctor.
That was the wrong doctor for me.
For anybody.
And I think that's the wrong doctor for any person who wants to have a voice in their health care.
Yeah, good for you.
So I then left that doctor fairly quickly and went over to Mid-Main and had the complete opposite response.
Isn't that wonderful?
Yes, I did see a specialist. The diagnosis was sorted out. I was on a much, much, much less powerful drug.
And so for both of you, this is your main medical stop, your first and main medical stop.
Absolutely.
It's not a place where you live, it's not a place where you hang out, but it is your main medical stop.
That's where I go to see the doctor.
Yeah, okay.
And can I give you one other little bit?
Of course.
I don't dislike drugs, but I would prefer to take as few as possible.
Of course, yeah.
I have a very high cholesterol. My whole family does.
Ooh.
My cholesterol was off the wall. My doctor said Lipitor. Then she said, I know you're not going to like that.
Yeah.
She said, do you think you could go vegan?
Really?
And I said,
Interesting.
I could be a not so great vegan.
Yeah.
And my cholesterol was down by 22% in 2 months.
Get out.
My doctor said, now if we could up your exercise a little.
Yes, yes, yes. Of course.
And my cholesterol went down a little bit more.
You know what my cardiologist told me 2 months ago? He said, David, if you gave your medicines, including your Crestor, which is like Lipitor,
Yes.
it's a statin, if you gave those to a friend who lived 5K away from you and had to walk every day to his house to take that one pill and walk home, the walking would be more important than the pill.
Yeah, that's good. Yeah.
Yeah, absolutely.
Yeah.
So now, what has come? First of all, what's the address of Mid-Maine? Where is it?
It's at 24th and Main, right on the corner.
Ah, okay.
Yeah.
So, what news came down recently? I mean, what are you understanding about what's happening to the clinic, to the center?
Well, I'll start. Okay?
Go ahead, yes.
So Mid-Maine is a little different than the others.
Okay.
Mid-Maine is a nonprofit society, so it has its own board and it's a bit more independent. So it's not going to be closed down.
Okay.
What they said to Mid-Maine is that they were going to take out all of the multidisciplinary care support. So what that meant was they were not going to they're not going to fund a nurse practitioner anymore. They weren't going to fund a pharmacist. And
What did you say? Oh, a nurse practitioner.
a nurse
Yes.
practitioner and a
Okay.
pharmacist,
Yes.
and most of the support staff. What that
Yes.
effectively means in terms of programs
Yes.
is that they were one of the few centers that do group visits and really help manage chronic conditions. So really help with the
Yes.
things like Joann's describing and keep people healthier.
Home visits to the elderly.
Home visits to the elderly they do
Huge,
as well.
huge.
Yes.
Yeah.
They do that way more than other people. They're
Yes.
open extended hours. They're on call 24/7. They're actually used as a teaching center. And a lot of that also depends on the admin support staff who
Yes.
proactively call patients in. So when you have a chronic condition and they know that you need to be monitored more carefully, they call you in. So all the things that make it a really preventative center and really reduce the use of emergencies and hospital services, all of those were the services that they've decided that they're not going to fund anymore, and they were going to fund a very limited amount of support, and the doctors would stay in place.
And the groups, Marcy.
Yes, I did
yes,
say the
you
group.
did,
Yeah.
but they really help get groups of patients together who can talk about what's going on.
Yeah.
And everyone says, I'm doing better now.
Yes.
Everybody.
So you won't be surprised that Gloria Levy, who always has something good to say, wrote a letter to the editor as soon as this announcement came down, and she said, this is classically penny-wise and pound-foolish. She says the Mid-Maine Community Health Center is a jewel in the crown of our healthcare system, and this is the warning she puts out, and I want your thoughts about what she says. She says, watch the emergency rooms get even more overcrowded, more expensive acute care beds filled with seniors awaiting placement, and the pressure of building more nursing home facilities, and compare the costs.
Exactly.
I see you nodding, yeah,
That's
like in agreement.
succinct.
Yes, and
Accurate.
you know, there's actually evidence and research studies
Yes.
that show that. So the community health centers in Ontario have absolutely the best outcomes in terms of reduced emergency room visits, the same model as Mid-Maine. The problem here is that there's no research. All this decision was made without really looking at, they say that it's cheaper not to cut those services, but they're not, they did not look at the costs of hospitals, which of course are much, much higher.
Of course, of course. And the doctor who has done all of this, Rolando Barrios, put an op-ed in the paper immediately. He's Vancouver Coastal Health Senior Medical Director for Vancouver Community. And of course, he says it's all just swell and no one will notice any difference. I can't believe that you won't notice any difference.
A lot of people will notice a difference.
I mean, it sounds to me like these local health centers are, in a way, core fabrics in the community. Mm-hmm. They're almost like a community center or a church or a synagogue or a mosque. They're gathering places, are they not? In addition to being a place with healthcare.
Yeah, I mean, they aren't in the sense of there aren't that many social activities
I understand.
per se,
Yes.
but it does bring people together.
And one has a sense of
group
well-being.
care.
Yes. Yes, and that was that's a common theme. It's the trust, it's the motivation in the group visits
Yes.
that's provided for you to look after your own health. So it's a whole, approach that really, really focuses more on prevention.
So the man who's responsible for making this move of shutting down some local health centers and moving people to, is it called Ravensong? To
Yes.
Ravensong. He argues the city's vulnerable populations have moved east, and VCH must now reconfigure thus. How does he figure that the city's vulnerable populations have moved east? Who has demographics to prove that?
Well, that's what this external review said exactly,
Yeah.
right? The
Yeah.
external review said you don't have the statistics, and should you? They're focusing on 5% of the top. That's what they say is the high needs.
Yes.
But there's a really big question: should they be focusing on 10, 15, 20? You know, what is the percentage of
Yeah.
people who have serious health conditions that, if you really provide them additional support, they're going to be healthier, they're going to stay out of emergency, and they're out of hospitals, and they don't have that evidence to
And
make
if
that
you
decision.
if you live around a hub that we'll say is 25th and Main, I was just there yesterday having coffee. If you live around that zone, that hood, you're going to go down 8th in Ontario? Come on.
Well, not
Buses,
only that.
taxis, what?
How many buses? How many taxis?
Yeah.
What's going to happen when all of these people come all over the city, come
Yes.
to Ravensong?
Yeah.
How are they going to get there?
And cross a main intersection of Broadway and Main.
Uh-huh.
You know, and walk down the hill and then walk up the hill.
Or where are they going to park? Where are they going? Where are they going to anything? Get there, park, use Handy Dart. Who's going to pay for Handy Dart? Whose budget? I don't know whose budget that is.
That's an excellent question.
Yeah.
Yeah, well, and I think your point is a really good one, which is it probably makes sense what they're doing for the people who are young, don't have attachment to their doctors, who are dual diagnosis, who are mental health. Like that's who I really think they're talking about.
Okay.
You know, because those people, it does make some sense to provide a centralized clinic that's open more hours, right?
Yes, they're going to
And
be
that
open.
area
Yeah.
might make sense for that, and they're more mobile, right? But it doesn't make sense if you already have a really good relationship with your doctor. The last thing you're going to want to do when you're really sick is the doctor tell you, you know what, you're too sick for me to look after anymore. I'm going to send you somewhere else. Like that's completely against anything commonsensical or anything that.
We're just a moment away from taking a break, but is this or is this not a classic case of if it ain't broke, don't fix it?
It is.
It's not only not broke.
Yeah.
It's excellent.
It's a lovely
It's
thing.
a great healthcare experience.
Yeah.
And one of our points is not less mid-Main, more.
More.
Mid-Main.
Okay. Just hang on. We'll take a little break, folks. Give us a chance to say hello, and you can send us an email to davidberner.com. We're always happy to hear from you, and an opportunity for those lovely people who support this program here to say hello on Shaw Community Television Cable 4. We'll be back with these ladies just in a moment.
And we want to have a chance to tell it.
This program has been made possible in part by the following sponsors. The Trial Lawyers Association of BC. The Vancouver Courier newspaper. My new book about addictions, All the Way Home. Building recovery that works. We are back with Joann Perry and Marcy Cohen, both patients at the Mid-Main Health Center, Health Care Center? What's the full title?
Community Health Center.
Community Health Center. And this is one of several community health centers that Vancouver Coastal Health is saying must either shut down entirely or curtail serious components of the work they do and have everything amalgamated into one location at Ravensong Health Center at 8th and Ontario. And there are a number of us, myself included, who think that this is a foolhardy move. We don't quite understand why they think they're going to do it. And Joann and Marcy both are patients and have been for some years at this health center, and you're appalled by this decision.
That's right.
Yeah. So you have a website, and what do we do with the website?
Well,
You want people to come to it?
we certainly do.
Absolutely.
Tell us about it. What is it?
It's called supportmidmain.ca.
Yes.
And we have a place for patients to sign on, and we have a
Okay.
page for supporters to sign on. And
Yes.
really what we're trying to say to people is if this kind of care makes sense to you and you think it should be actually the model that we have across the province, please sign on, and we will use it to say to the health authority and to the provincial government there should be more Midmains, not less.
Okay. Now look, here is the doctor who is making this move at Vancouver Coastal Health, and he says he's spending $500,000 funding Midmain to cover office staff, admin, and so on. Well, I've never known Vancouver Coastal Health to be so brilliant about curtailing administration costs because they're top-heavy, like so many others. But so cut back on this. Why can't he have one office to do the admin for 5 locations? I mean, there are other ways to skin the cat.
Mm-hmm.
Yeah, but one of the things is that when you have support staff there, one of their
Yes.
jobs is to help bring people into these groups and help organize these groups. So in terms of the preventative care, they play a key role. They get back to patients, they proactively contact them, they make sure they come in. So it's all part of keeping people healthy, and it's all part of what we know from the literature internationally makes a difference, right?
Yep.
So they aren't just like, shoveling paper. They're actually supporting patients.
I work at a clinic one day a week, and I can tell you from experience, I've known this for years, that usually the front end staff, they aren't just paper pushers.
No.
They're working in a very important way with clients walking through the door, and they have to be very socially skilled and so on. Yeah.
Exactly.
Yeah, they have key roles. Give us, besides your own experience, give us another success story or two. Yeah, tell us about.
Yeah, so let me just read you. We've got
Please.
testimonials, and people can go on our website
Please, yeah.
and put a testimonial on or
Yeah,
see them. So
yeah.
I'll just read one here, and maybe
Okay.
you'll want to read one.
Go for it.
So this is from one patient. Left without a doctor when my previous GP resigned, I was put on the waiting list and became a patient of Midmain in April 2007. I learned of the clinic from my mother-in-law, who ironically couldn't become a patient because she didn't live in the neighborhood. Being so accustomed to sitting in a waiting room, I continued my practice of calling the doctor's office 40 minutes before my scheduled appointment to see how far behind they were running. To my surprise, they were consistently on schedule, and I stopped this routine call. I was so impressed with the efficiency, availability, and care and approach that when my husband suffered a heart attack in June 2008, I asked if he could be taken on as a patient. Being the mother of 2 young boys, I also had them taken on as patients so the same male doctor could provide care for them as they matured. The doctor provides care to me, my 62-year-old husband, and my 2 sons. He knows our family, and he uses our complete medical history to provide us with comprehensive care. The attention we receive at Midmain harkens back to the old-time patient care, where doctors are involved in their community, took time to know their patients, and followed up with phone calls. My younger son was diagnosed with salmonella poisoning in June 2011. The clinic not only followed up with a phone call regarding the diagnosis, but also checked to ensure my son was improving. Our clinic is a model that should be emulated across the province. Every staff person at the clinic is part of the team that makes the care exceptional.
Now, Judy Darcy, who's the NDP health critic, and we would expect a response from the opposition, she said Vancouver Coastal Health needs to reverse the direction. This is an ill-considered plan. And she says this is important. She says, the government says this is not about a cut. She says it's about reprioritizing. That's the kind of bureaucratic language that puts your teeth on edge. But anyways, she says, but it is absolutely about a cut to primary care, quality preventative care to thousands and thousands of people in this community. Mm-hmm. So suddenly this place that was a welcoming kind of place, a place that you, even if you were ill, you felt pretty good about going to because you knew you'd be taken care of. Suddenly this place is going to shrink or entirely evaporate, and you're going to go to some central place. Are there going to be lineups at 8th and Ontario?
Well, they're only taking the 5%. They say that,
Yes.
what this is, you know what you said at the beginning, you talked about a chess game?
Yes.
Well, this is the chess game.
Yeah.
So they're saying at Vancouver Coastal they're only concerned with the 5% people who end up in hospital. And here, they're not concerned about everyone else in primary care. That's really the province's job, and that's under the fee-for-service system. So what they're going to do is they're going to save money out of the Vancouver Coastal Health budget with the hope that the physicians will then go on fee for service and under
Yes.
the provincial budget. Same for us taxpayers,
Yes.
but it means savings for the
Yeah.
Vancouver Coastal Health.
And Adrian Dix may not have been able to get elected, but he's right on target on this one. And he says, look, we're going to be sending more people to acute care hospitals.
Yes.
And the moment you walk into an acute care hospital, the meter's ticking, and it's, what is it, several $1,000s an hour?
It's $1,400 a day, $2,000 a
Yes,
day.
yes.
It's
Yes.
huge. The other part, and it's a source of real irritation, is that
Yes.
our local or provincial government put out a document just 1 year ago. It's called Promote, Protect, Prevent. Our health begins here.
Yes,
It's called BC's Guiding Framework for Public Health.
yes.
And what it covers are so many of the things that we do at Mid-Maine, that patients experience at Mid-Maine.
I have to tell you something. I'm laughing because I'm looking at this document that you brought. I have collections of
Yes.
these at home.
Yeah.
The government's always turning out these lovely documents, piles of paper, and I don't know what they cost.
Well, Vancouver Coastal Health Authority claimed that part of what it was doing was based on this.
Yes.
And you'd be really hard pressed to find it.
To find it in there.
You would be very hard
Where
pressed
does
to
it
find
say close,
Yes.
highly visible, much beloved, highly efficient community health
Yeah.
centers,
Yeah.
and put people into one,
Yes.
cookie cutter?
And this also talks about neighborhoods, about communities, about people being where they're supposed to be.
And
Yeah.
I'm going to talk about another report that's from
Yes.
February this year.
Yes.
It's also from the provincial government.
Okay.
And what it says is that we should be moving to interprofessional primary care as a priority.
Yep.
And it says that every single community in this province
Yes.
should have, the primary care should be more interprofessional.
Yes.
And the group
Which
medical.
means what? That you have a number of different kinds of doctors and medical people available.
You would have what we have at Mid-Maine. You would
Yes.
have, you would potentially have a pharmacist. You would have a nurse practitioner. You would have nurses. You might have, depending on the needs, you might have a mental health worker. You might have a social worker. You might have a nutritionist. They might be part-time, but
Yes.
you would have a team so that you can, support people in a more holistic way. And that's what all those group visits are, and the chronic care management. It's not the doctors who run them. It's primarily the other health
Yes.
professionals that are really good at running those clinics and that keep people healthy.
Yeah.
So the province is actually saying that's the model we should go to.
Yep.
Yes.
The exact model that they're trying to cut it Mid-Maine by the health authority versus the province. So they're completely not in sync with each other.
Well, maybe they have this age-old problem that bureaucrats have. They don't walk down the office and down the hall and talk to each other. They've got closed doors, and they're all walking around with one piece of paper.
Yeah.
This is my experience of working at the CBC. There's always someone walking down the hall with a piece of paper. I don't know I never understood what that had to do with making television programs or radio programs, but
Right.
there's lots of people with a piece of paper.
Yeah.
Yeah, and they've got budgets, and they
Yes.
only look at their budgets, not looking at the overall, what's the best for the health system overall, what's the best for the patients overall.
So we just have 2 or 3 minutes left. You've got this website, but is there any other political action planned? What, if anything, are you doing to try to prevent this from going forward?
Well, we're going to meet with Vancouver Coastal Health Authority next
very
week.
good, good.
So we are going to do that.
Give them my regards.
And
Yes.
we are trying to get more information pulled together, more signatures of support for this.
Yes.
People from our group have been going to meetings that the other health clinics that have been cut,
Yes.
rallies that they have had in their neighborhoods. So we're trying to make sure that we're, although we are different, that we still have some connection with the other health units, so that when it's time for the whole voice to be heard,
Yes.
that perhaps we can work in that direction as well.
Do you have any doctors on your side? You have doctors who are speaking up?
We do,
Yes.
and there was an article, there was an op-ed in the Sun by a
Yes.
couple of doctors
Yes.
just this last week.
Yeah.
One was a health administrator and one was
Right.
a UBC
Right.
professor doctor. And we have, certainly the doctors at the clinic and lots of other doctors have showed their support.
Yeah.
And that's part of the website. People can sign on and let you know if you're a health professional.
And these doctors are able to support you without it appearing to have a self-interest.
Well, I mean, the people that are in the mid-Main clinic, are the doctors there,
Yes.
have to kind of keep working with the patients
Yes,
and
of
do their
course.
best, right?
Yeah, yeah.
But other doctors have spoken out,
Okay.
and they are speaking out.
And they are removed from the situation.
removed.
Yes.
So nobody could accuse them of saying, yeah, but you're just watching after your own
Exactly.
salary.
No, it's out
Yeah.
external support coming in.
Yeah, and I also think that I think that there's so much support coming from so many places. We've got national support from community health centers. I don't think we're going to let go of this.
Good.
I think we're going to continue, through the next period, because I don't think they say they can keep Mid-Main. They admit Mid-Main is a great example, Vancouver Coastal Health.
Yes.
We don't think that it is possible for Mid-Main to remain. And so we're going to be there every step of the way, raising the concerns. We don't plan to let go of this.
No.
And the more we can get other people from the public to show their support and say they want this kind of model, the better we are.
Right, and they've got their numbers.
Yes.
We've got people.
Very good. I love the good way to end. They've got their numbers. We've got people. Thank you. Ladies, thank you so much.
Oh, thank you.
Joann Perry and Marcy Cohen. Lovely to have you here. And best of luck. We'll keep monitoring this story.
Good.
Okay, thank you.
That's it for today, folks. Next week, we interviewed Dr. Carl M. Williams, a forensic psychologist, about risk management with violent behavior, with violent offenders, and somehow we managed to never air the program. There was some confusion, but anyway, we're going to air it next week, okay? And then I'm off on a holiday, Bon Viaggio, and so we're going to do some repeats, and they'll all be good shows, of course, and back with you in June, also on a healthcare issue. Thanks so much for being with us, and have a good night here on Shaw Community Television Cable 4.